Hi, I'm Dr. Thomason. We're here today with Steve Brown. And Steve, you'd expressed an interest in sharing your results from the Balancing Blood Sugar program with anybody who was interested in that. So let's start by asking what you originally came in here for.
Well, I was diagnosed with type 2 diabetes in the middle of September. Being diagnosed with diabetes was very alarming, and I wanted some optional therapy and diagnosis, different treatment options.
Mm-hmm.
And you presented a new option to me as far as dieting and supplements and an alternative treatment.
Okay. So you came here because you were diagnosed with type 2 diabetes, and you were on insulin when you actually started this program. Is that correct?
Yes.
Okay. And what were your fasting glucose numbers when you started this program?
It was ridiculously high. The reason they put me on insulin immediately is because I had been reading peaking at 600.
Okay.
The fasting was probably 250 or something like that.
Okay, so 250 fasting when you were first diagnosed,
Yes.
and your sugars would drift up to 600
Yes.
when you were after eating. And so we already said that you were on insulin when you started this program. Now, what changes have you noticed since you've started this program?
Well, you made me aware that weight was a big factor. I've lost over 50 pounds, and I have
50 pounds in 3 months.
50 pounds.
Okay,
50,
fantastic.
3 or 4 months.
Okay.
I took it serious, and I understand that from you and reading and your program, that weight was a big factor, and I took it very serious. And
So the changes that you've noticed that I have here, you've gone off your medication. Is that correct?
yes,
Okay, and you brought blood sugars down to what levels? What are your current numbers right now?
Right now, I am off of insulin and metformin. I'm at right around 90 to 100.
90 to 100 off your medication.
Yes.
That took you a little over 3 months so far off of all medication, and you lost 50 pounds in the process.
Yes.
That's fantastic. Let me just ask you one more thing, Steve. Would you recommend this program to somebody who was a diabetic or pre-diabetic, somebody that wanted to bring sugars back down into normal and wasn't satisfied with a conventional medical route?
Absolutely. It's nice to know that there are alternatives on how to get well.
Fantastic. Steve, thank you very much for your time.
Thank you, Doctor.